Hello and welcome to everyone. Thank you for joining us. It's my pleasure to welcome Sasanka Sai Yella, who is Chief Operating Officer of DeliverHealth. Sai, welcome. It's great to have you.
Thank you, Mike, and really appreciate your introduction and look forward to talking to you today.
Yes, absolutely. Very briefly, tell us about DeliverHealth in a few sentences, and then we'll plunge in.
No, absolutely. DeliverHealth has nuanced roots. We started this company about a year back through an acquisition of assets from Nuance, primarily focusing on the clinical documentation and digital health and also EHR services. And we continue to expand and grow and serving our 800 plus customers through these services, and look forward to sharing more about our plans and roadmap during the discussion.
Okay, wonderful. Thank you. So let's talk about an interesting set of relationships. We know that at the core of healthcare is the provider-patient relationship, and we all understand that. But there's another vital relationship, which is the provider-vendor relationship, especially in the age of digital health and technological innovation. How do you see the provider-vendor relationship changing and evolving forward right now in this environment?
Yeah, great question. If you look at healthcare, they've gone through many transitions, for example, meaningful use. But the current transition is about operations and the business model. Today, we have to be more effective in our operations, and the business model, how patient is engaging with the healthcare, is evolving and it's changing. So to support this transition, the traditional approach of the healthcare provider working with the vendor on pure price optimization is irrelevant. Today, it needs to be a little more strategic, more enable to the evolving business models, so that can be a strategic nature on how the providers can transform into a more digital and also more effective operations organization in this changing world. So that's the shift from a very transactional, price sensitive to more strategic and partner-driven approach. That's the shift to support the evolving business models.
Yeah, and I love that you just referenced a partnership approach, but what does partnership mean in this context? We've gone through so many iterations of the provider-vendor relationship in healthcare IT. It seems like we've gone through different periods in which different elements of partnership were more important than others. What does the landscape look like right now around partnership to you?
Yeah, that's a great question again. From a partnership point, I think there are two core ingredients. And it's also changed from the vendors too, how they work with the healthcare providers. Number one ingredient is the empathy aspect of it. Each health system is going through a specific journey related to how to take care of the patient in a most effective manner, especially after COVID. The dynamics of staffing, dynamics of costs have changed, and also the digital experiences. For example, patients are paying through a click of a button. They're taking an appointment with the click of a button. That didn't exist 5 years back. So those things are evolving. So the relationship is with the partner is understanding the provider on where they are on the journey, understanding the market, understanding their core capabilities and their maturity. So the key component of this true partnership is empathy and listening. Now, once you understand the customer situation and the journey they want to take, The second part of these more important, that is the competency, or what we call it as expertise. So it's just that, and it's the combination of that, having the tremendous level of listening and empathy, and followed by a core competence on expertise. Those two things are incredibly important, or the core ingredients of a true partnership. One doesn't, if you have no empathy, then you're always selling something. If you don't have, only empathy, then you are not able to execute that journey. So that's my opinion, that the two important ingredients of true partnership.
Yeah, exactly. And I think there's something in there that I think is fascinating, which is that we all know that technical competency is important. Obviously, that's the basis. You can't just sell hugs, right?
Yeah, yeah, exactly.
But at the same time, what's interesting is there are vendor organizations that are doing very well by doing good, meaning that they also have crafted a modus operandi that is helping, assistive, facilitative. How do providers find that? Because every vendor will say that they're partners and that they value the relationships and blah blah blah. How do provider leaders, CIOs, CTOs, CMIOs, etc., figure out who will actually give them that kind of partnership that will move them forward? Are there clues as one goes through the vetting process and the selection process?
Absolutely. There is no, formula that says if you do this, 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 then they are partners. From my experiences, I asked the same question what you asked very recently to one of our customers, one of large customers, and asked them, what do they look from the vendor's point of view when they are, in this current situation? So the feedback they had given me has actually had a profound impact on how I look at relationships. Number one is it's the listening capability, right?
Hmm.
Looking at foundational, what's going on with the providers. If you're talking to a revenue cycle, department head, understanding what challenges they are going through. Like, it's not, the first thing, everyone is going through staffing challenges. Understanding them really on what's the level and intensity and what's the barriers for them to overcome. So listening is the core part of it. I would say that's number one. Number two is, offering suggestions and thought process that are outside your core competence, because you're looking at overall customer success. Like, for example, we may not be doing ABC, but it is important to suggest what is good for the customer. And that will actually show up in the meetings when you are in the conversations. Is this authentic? Is this individual or partner is authentic enough to listen and share what is right for them? There are scenarios we actually said we may not actually be the right solution for you because there's actually a better solution from our other partner. We should be comfortable in that particular scenario. I think those are some of the signals I would say are important for the providers to understand. Are they listening? Are they looking from a customer point of view? And is it holistic success is more important than driving a point solution into the provider system? That's my opinion. And I feel providers are incredibly smart. They can see through what is authentic and what is not authentic. And I feel, that's how, there is no scientific formula, but that's how I feel that things will evolve.
I think that makes a lot of sense. I mean, one of the things that is becoming very clear is that there's no longer any off-the-shelf plug and play, we just hand you software and you go situation in most cases. It's all about the interaction,
Yeah.
because it's a journey and there are complexities, and providers, patient care organization leaders need a lot of help right now, and they definitely need that partnership. So thank you for clarifying that. So one of the things that we're all aware of is the need to simplify the complexities of healthcare. Tell me from your perspective, Sai, what that looks like in the context of this discussion around the provider vendor relationship and partnership. How can a successful relationship help to simplify some of the complexities that we face?
Great question. And, Apple had a Steve Jobs had this statement, which I was very impressed long time back. Simplicity is ultimate sophistication, right? It's actually one of the hardest things to accomplish. Our thesis is couple of, core principles, which is, how we can clear the path for connectedness. Like you said, there is no one solution that can solve all the healthcare problems. There is no one software or one service. It's a collection of softwares and services that are enabling the healthcare system or providers to mature. Take, for example, in digital, which is tremendously impacting how innovation is happening. From taking an appointment, there is an app. Once you go into the provider setting, there's an app to do the check-in, or even before the check-in, right? And afterwards, there are systems to record the encounter. Post that, there's a lot of AI-based point solutions on how to accelerate the coding, billing, all of that. Then there is a patient payments. And now in chronic situations, depends on what kind of disease you're going through, you are connected to some level of devices, all the way from a weight scale to a post-cardiac surgery device that's hanging in your neck. These are all apps and devices. Right here, I walked through about 10 apps and devices. And in a real care setting, there'll be hundreds of apps and devices. So how do we actually make all these things work? The first thing is having a clear understanding on what we are trying to accomplish. The second objective is understanding the most important part is enabling these scenarios. There is no one solution. Idea of we'll eliminate all point solution is like, it's almost impossible. So our focus is, how can we create a method to connect all these things, enable them so that they are cohesively acting upon from a best interest of provider and patient and physician. It's very important. Physician cannot look at 15 things in a 15-minute encounter, how they all come together. So our method is the cohesive approach, a roadmap, and also very holistic approach on how to look from 3 dimensions of the solution.
Yeah, absolutely. And one of the things that's happening now also, as you know, we're pushing further and further into value-based healthcare contracting. Tell me how, which is very demanding for providers, how does the provider vendor partnership element fit into that?
Yeah, it's not one scenario. It's value-based care is an important scenario because everyone is moving from, at some level, trying to move from, fee-for-service to value-based care. And that's where I think a continuous care engagement is very important, right? For example, if you look at, my goal is only number of visits or number of surgeries, that's interesting. And that's where I think that's shifting into, it's not the visits, it's not the number of surgeries, it's some more effective way of collaborating, the effective way of those engagements. So I think that's where the software, services, devices, patient-enabled, patient-driven data, all of them are coming together. So it's important even more to understand how these devices, software, data, all of them are coming together. For example, if you are a diabetic patient, is the data flowing in from, remote patient management is a very important piece of every provider strategy, how the data is coming through. And now the next step is, how do we use the data effectively to do a care? So it's not like one cookie cutter solution. This is how you can make from A to value-based care. It's a combination of these things will evolve into a true value-based care. For example, when we are looking at living well, a lot of providers are now giving digital front door or digital applications that include not just healthcare pieces, but also wellness. Why do you think that healthcare is giving wellness apps like meditation apps or diet apps or food apps or sleep apps? All of these things are helping the individual to be more cared from a holistic point of view, not from a very narrow patient, but also from a holistic point of view.
And that really speaks to the provider-vendor partnership being facilitated, because there's so much iterative development that has to happen.
Yeah.
Correct?
Yeah, absolutely. Absolutely. And also, we are in so early in this journey, and there needs to be a partnership to evolve. There might be scenarios where there is very experimental in one scenario, or there might be another scenario, there are multiple options. And all options are right. Question is what makes sense for that particular provider, what's their maturity and competency on those scenarios. Those are some of the evaluation criteria that needs to be made.
Absolutely. So what do the next few-ish years look like to you, Sai, as all of this moves forward? What will, let's arbitrarily say 3 years from now, what will vendor provider partnerships look like 3 years from now? How will they have evolved forward?
Yeah, that's if I wish I know the perfect answer for that, but I can. My thesis here is it's in a twofold scenario. There's an established services, right? There's a traditional established services. In that scenario, I feel the partnership will evolve into more tighter core competency and managed services scenario. For example, partners will proactively offer a holistic, full package services. For example, today there used to be a shared ecosystem where, take for example, coding. There used to be coders inside, outside, multiple vendors, and so on and so forth. And that might collapse into a single managed service or multiple managed services so that health systems can focus on what they're really good at. So in an established services, there will be more consolidation and the relationships will be more deeper, and rather someone will overtake that particular service. In an emerging scenario where this is more evolving, like remote patient monitoring, digital devices, and virtual care and the application space, I think the partnership will evolve into more of how can we do a more transformative services. So there is a little bit of experimentation. There is no leader in any of these classes yet to claim that they had figured it out. So
Mhm.
there might be the partner is about how do we bring the best package? How do we bring patient payments, the health assessments, appointments, the CRMs, the patient data, all of these things together, or telehealth into a meaningful package? That's, I think, is very powerful. So there is a two types of partnerships will evolve. One is expertise and competence at volume and scale and effectiveness. Other one is more transformational and strategic, where there will be simplicity and more experimentation happening.
That totally makes sense. Thank you. And in that context, can you leave us with a little bit of advice? What advice would you like to give to CIOs, CTOs, CMIOs, and others who are going to be the decision makers in purchasing software and services? What should they be thinking about in the coming months to couple of years?
I think, like I said, fundamentally, the two pieces are, evolving. And if the health systems and providers don't evolve, and they will be left behind, or for that matter, they may not exist. That evolution is about optimizing your existing operations. And that means that how can we do more with less? I think that's a very important
Mhm.
transformation. And the second one is how do we evolve into this digital model where wellness, digital patient engagement, and established business all come together. In that scenario, having a right strategic partner is incredibly important, and who can help them to through the journey in unconditional, unbiased approach is very important. So it's a very, it's one of those weird scenarios. Typically, it's one thing. How can we optimize? How can we simplify? How can we implement? But here is the time where we need to optimize the services, but also transform into a new model of care. So I think it's a very interesting scenario. Definitely, my advice is, focus on core competence, focus on a partner who is willing to listen and help the journey into transforming into a new business.
Yeah, absolutely. And the scenario you just shared with us, Sai, reminds me of the whole the phrase that is sometimes used, refueling in midair, right? Like,
Yeah,
right,
and changing
planes,
the course.
right, exactly. And and preparing for the next step while you're, deep in the trenches. I think one of the most important things, and I agree completely with what you shared, provider leaders are really going to have to think strategically. Another metaphor, skate to where the puck is going in hockey. In other words, move forward strategically, anticipate scenarios, anticipate where the market might be going and where the industry might be going. In other words, don't just do business as usual, but think forward so that you're not left behind. Does that make sense?
Absolutely, absolutely. And this is the time where the CIOs need to work with marketing, work and finance and operations, because this is not one executive's agenda. This is a transformation agenda that touches every executive in the health system. So it's definitely is one of those pivot points that we all today, do you think any one of us go to a travel agent to book a trip?
Right.
Absolutely not. We changed. Some even doesn't know that there's a travel agent concept existed, right? How easy today we go to the restaurants and we scan the menu, and it was just an year back where the people used to come and provide. And so these are like they're coming at a faster pace, and they're coming with incredible change. And if you don't change, your costs are different and your experiences are different, and you need to deal with consequences. I think today change is important, and it's important to evolve. Otherwise, relevance in healthcare will be at risk.
Absolutely. You made me think of the gentleman who was my travel agent many years ago, who ended up becoming a yoga instructor. So the world is changing quickly, and you're right. Like my daughter's 20, people her age, when you tell them that there were things such as travel agents. I mean, there are a few travel agents for very specialized travel, but
Correct.
as an industry, it's basically gone.
Yeah.
20 somethings are just amazed. And they're amazed that there was a world before smartphones. And I think you're exactly right. The technology is changing also, so that we need to think strategically, because thinking purely tactically will not get you where you need to go.
Exactly.
Yeah.
Exactly. Yeah.
So, well, thank you so much, Sai. This has been a wonderful conversation. I know I've learned a lot. I'm sure our audience has. So thank you for being with us today.
Thank you, and nice talking to you, and look forward to continue the discussion. Thank you.
Absolutely. Thank you. And thank you to you and our audience for viewing. This concludes the session. Have a great day, everyone.